love that you use that because that's not typically the context we hear the term in. At least in my world of internal medicine, when I hear population health, it's are their blood pressures at goal,
Right.
glucose, are the lab tests where have they been sent to
Right.
the podiatrist and all the
Right.
things. So that's, I think, what most of our healthcare listeners might hear with that
Mhm.
term. I don't think that's how you meant it, though.
Mm-hmm.
You
Yeah.
want to
Well, I
speak on
have
that at
a
all?
bit of, sure. I have a bias. I also have a master's in clinical epidemiology. So I think one of the most rewarding things to me in medicine has always been to see patterns.
Hmm.
So when I think about population health, and my initial residency and boarding was in public health, preventive
Hmm.
medicine and public health.
Hmm.
My second residency was in family medicine, which you learn about in the
Yes.
book. And I went back to do that to focus more on women's and children's health. And that's
Hmm.
really the crux of the story here. But going back and thinking about that epi background and that epi bias,
Yes.
um, I feel like it's learning about the connections between the stories, and that it's partly the perspective that I've gained through that kind of study and thinking about things from the epidemiological perspective and the population level. But to me, I love seeing the patterns. I
Okay.
love hearing stories from five different women,
Hmm.
say, and in this book there it's my story, my family's story of our complications in building our family, and woven in are the stories of 21 other women from my practice, friends, medical coworkers. um, I love hearing, let's say, five of these stories that sound like they have nothing in common on the surface, but when you really explore them with each person, with each woman, you see the universal threads.
Yes.
And that's what I mean by population level. You see
Yes.
that we have so much more in common, both in our perspectives and our stories and just in our lives, than we do that's different. And
Yes.
everyone is going through something. It's just the details that matter.
And is it a violation of trust if patients feel like we're not willing to meet them where they are? And I realize some tests we shouldn't run at all. Other tests, there's a lot of gray. So not even getting into all that, but just when a patient's coming and they're saying, I really think I need this test, are we doing them justice to tell them no and then they get it somewhere else? Are
Mhm.
we decreasing trust in that process? That's exactly how I was trained, is what you said.
Mhm.